Hello friends, welcome back. If you're new here, then my name is Sumbul and I'm a graduate student at the University of Edinburgh studying psychology. Should I say clinical depression or feeling depressed? And are they not the same thing? I'm pretty sure, just like me, you get confused between people suffering from clinical depression and people feeling depressed. And yes, they are entirely different things, and you have come to the right place to educate yourself. Before I jump onto the content of this video, I just want to say that the purpose behind this channel is to give you the information that is science based, that's completely backed by science and empirical evidences. And if you want to support my initiative, then please do so by subscribing to my channel. And if you find this video helpful and you think it is very educational for you, then do hit the like button as well. Depression is a very common mental health issue. It is estimated that approximately 5% of the adults suffer from depression worldwide. The percentage is a little higher among older population, that is, people above the age of 60 years, and the number is 5.7%. In the year 2020, an estimated 21 million adults in the United States had at least one major depressive episode, and the number 21 million represents 8.5% of all US adults, and by adults I mean people above the age of 18 years. Before I speak further, I just want to say that just like a knee injury or a cardiovascular disease, mental health disorders or mental illnesses are also real illnesses, and depression is one of them. So if people try to tell you otherwise, I hope after watching this video you will be in a better position to explain to them that what they are thinking is wrong. If depression is not treated on time, then it becomes a serious health condition to the point of suicide. In fact, it is so unfortunate that around 700,000 people commit suicide every year, and it is the fourth leading cause of death in the age group of 15 to 29 years. People who suffer from depression are unable to function in their personal, social, and professional lives. If you remember, in the beginning of this video, I mentioned clinical depression and feeling depressed. So what exactly is clinical depression? How is that different from feeling depressed? We all feel down from time to time, like every single person on this earth. No one's life is devoid of negative events and negative emotions, like failing an exam we worked very hard for, becoming unemployed, losing a loved one, losing a job, or even getting a divorce, and many more reasons. In such circumstances, we all feel bad, we feel angry, we feel sad, and we can be worried. In other words, we feel depressed. And after some point of time, we start feeling better because circumstances have changed. Maybe we might have just gotten a different job and we are actually enjoying that job now much more than we were enjoying our previous one. And we just don't feel sad or depressed, or we don't feel down anymore. Rather, we feel good and positive. However, that's not the case with clinical depression. It doesn't go away even the circumstances have changed, even when people just think that should be the case. According to DSM, that is Diagnostic and Statistical Manual for Mental Disorders 5, a clinical diagnosis for clinical depression, or MDD if I become a bit technical, that is major depressive disorder, it basically requires at least 5 symptoms within a 2-week period. And those symptoms are depressed mood, feeling sad, empty and hopeless, loss of interest and pleasure in the usual activities, daily activities, weight loss or weight gain. Like some people gain a lot of weight while others lose a lot of weight. So that just varies from person to person. Sleeping problems, like some people sleep a lot and some people just lose their sleep. Psychomotor agitation, that is not able to concentrate and focus better in everyday activities. Feelings of hopelessness, worthlessness, and helplessness, and suicidal thoughts. One thing that is important in these symptoms, and I know I'm getting a bit technical, but I think it's important that I mention it, is that all these symptoms should not be attributable to substance abuse or any other medical condition. So imagine someone having all these symptoms for at least 2 weeks, and you will understand that clinical depression is just not about feeling sad, it's not about feeling down. It's a real medical condition, and fortunately, with all the empirical evidence that we have and much more to follow, awareness with respect to depression is rising. There are pharmacological and non-pharmacological treatments to treat depression. There's antidepressants with respect to pharmacological treatment, and there's psychological therapies. One of the best ones, or that has a lot of empirical evidence, is cognitive behavioral therapy. We also have mindfulness cognitive therapy with respect to non-pharmaceutical treatments. There is so much to talk about depression, and the literature is so wide that it is difficult to just cover in this short video. But I hope with this video you have now a better understanding that clinical depression is a real mental health condition, it's a real disease, it's a real illness, and it is not at all feeling depressed or feeling sad. Clinical depression just doesn't go away even when the circumstances have improved or they have gone better, or rather it will just keep on happening. It just prevails and all the symptoms need to be there for at least 2 weeks. I hope you have enjoyed watching this video, and if you enjoyed it, then do hit the like button and also make sure you subscribe to the channel. I will really appreciate it if you can support my work, and thank you for watching this video. Until next time.